also ask for, if you have health insurance, for you to scan the card. If you don't have health insurance, the vaccine is free for everyone. Let's just start right there. The vaccine is free. La vacuna
es gratis.
no tiene que tener seguro. You don't have to have insurance. It is free. Gratis.
If it's free, why do you ask me for my insurance card?
And the reason is that if you have insurance, we want to be able to collect money because the counties are paying for it all, right? And the state. But if you have insurance, we say, do you have insurance? And we'll go after it from the, we have your social security, excuse me, your insurance card, we'll submit a claim, but it's not necessary. It's just to be able to collect some of the money, but it tells you it's not necessary. Okay, it is free for everyone. It's
What are the side effects of the vaccine? The vaccine can cause headache, dizziness, fever, injection site reactions, meaning pain, redness, soreness. People can feel tired, fatigued, have a migraine. Typically, symptoms are 2 to 3 days at most. I will say my symptoms were 2 to 3 days as well. And those are the basic side effects. We need to acknowledge what the side effects are, that there are side effects of the vaccine. And we need to acknowledge that because people are looking and thinking, oh, there's all these side effects. We need to acknowledge there are side effects of the vaccine. But we also need to say, well, on balance, the side effects of the vaccine are a heck of a lot less than dying of COVID. So we need, when people have the hesitation because, oh, well, I heard of the vaccine side effects on Facebook or through the chisme, otra cosa es así. We need to acknowledge that. When we don't acknowledge that there are side effects to the vaccine, then we're stopping people. They're not going to listen to us if we're not acknowledging what they feel. But when we can acknowledge, look, yes, there are side effects to everything. There's side effects to the vaccine, but the side effects of not getting the vaccine are so much worse.
Because the speed, as you know, is related not to recklessness, but to the advances, spectacular scientific advances in platform technology. What about the safety and efficacy? Is it safe and is it effective? Should I believe the government? Heck, they lied to us so many times. Why should we believe them now? Is it the pharmaceutical company that wants to just make money on us? Well, it's neither, because the safety and efficacy determinations have been made by independent bodies like the Data and Safety Monitoring Board that really are beholden to no one other than you, namely the general public. They're not beholden to the government. They're not beholden to the pharmaceutical company. They analyze the data and decide if it's safe and effective. When it is, and the company presents the data to the FDA, the career scientists are the ones that actually decide. And they do it in association with another independent group. So the process is both independent and transparent. Those are the facts that we got to establish before we even have a conversation.
That's a great question. And, mRNA vaccines are relatively new, so a lot of people aren't familiar with them. Even healthcare providers aren't familiar with them. Basically, what an mRNA vaccine is it's the genetic code for the spike protein that Karen mentioned earlier. So the coronavirus, the SARS coronavirus 2, has these little spikes all over its surface. And the mRNA contains the genetic information to make those spike proteins. So when that vaccine is inoculated into the arm, injected into the arm, it goes into the muscle cells, and that mRNA tells the cell, make this protein. And the cell makes that protein, and then that protein is recognized by the body as foreign. And so the body produces an immune response, which is mostly antibodies, but also T cells and other responses that then provide the body with an arsenal to use if the body encounters the actual virus. And so the mRNA can't integrate into the DNA. It doesn't change your DNA. It doesn't mutate your cells. It just provides the coding sequence for the cell to say, these are the instructions I need to make this protein.
Today, I'd like to address the question everyone has been asking. Which COVID-19 vaccine is most effective? As you've seen in the media headlines, many are asking, what is the best vaccine? Although many statistics on efficacy are being profiled, fundamentally, the approved vaccines are all equivalent. Comparing vaccines is challenging because the clinical trial timing and setup differ. The only way to simply compare vaccines would be to have a head-to-head comparison, which isn't feasible currently. So where does that leave us? It's important to ask ourselves what these numbers are effective against. Essentially, they are reporting the efficacy in preventing all COVID-19 related illness associated with symptoms. These symptoms could range from mild cold-like symptoms, such as a sore throat or fever, or severe illness requiring hospital admission or worse. The critical focus at this time should be on these endpoints. All 4 vaccines are 100% effective in preventing hospitalization and death from COVID-19. This means that all 4 vaccines turn what could be a life-threatening disease into a bad cold, one that most likely will cause only symptoms such as fever, sore throat, or a mild cough. All 4 vaccines show these same results. That's what matters and is the reason we should all take the first opportunity to be vaccinated. It's a critical step towards protecting ourselves, our colleagues, friends and families, and the way out of this pandemic.
If you are vaccinated, you can be around other people that are vaccinated without social distancing, without a mask. I'm still a little leery of that, but that's the CDC guidance. You can go into a household of unvaccinated, low risk individuals, okay? And you can not go into quarantine if you're exposed. So if your friends came over, you found out one of them got COVID 3 days later, if you're fully vaccinated, you don't have to go into quarantine. And what do you have to continue to do even if you're vaccinated, which was the question? First of all, if you go to any medium or large gathering of individuals, you still have to practice masking, social distancing, etc. If you develop COVID-19 symptoms, you still need to get So most of the problems that happen post-vaccination with other vaccines happen within the first 6 weeks. We generally don't see a lot of issue going months or years out. That being said, I think it is a legitimate concern. This vaccine will be studied. Those in the study clinical trials are going out 2 years. I mean, that doesn't help you a lot right now, but going out 2 years. I am not really that worried about a long-term side effect. Again, you can't know. Generally speaking, vaccines, we don't see long-term effects. The vaccine is a messenger RNA. It's a clean, the 2 or the 3 are, it's a clean, it's a little piece of mRNA. There's really, quite frankly, not a lot it can do to you. And that was because I had that same concern. But when I started looking at the science and looking at the molecules and looking how it was structured, and then looking at other vaccines for the J&J, because that adenovirus platform from which it is made has been used, I think, maybe 10 different vaccines. So looking at them and being objective and understanding that I got vaccinated myself and I'm as concerned as anyone else, for those reasons, I feel very comfortable about having any concern regarding long-term side effects.
let me just share some of the facts for where we are. Point one, we know that there are some adverse events that were reported, but those are extremely, extremely rare. So more than 7 million doses of the Johnson & Johnson vaccine have been administered. And to date, CDC and FDA are reviewing data involving 6 cases. So even more rare than 1 in a million for a specific kind of blood clot in some folks who have received that vaccine. So this pause, comes out of an abundance of caution. I just have to say that twice, an abundance of caution. We know that the risk of getting struck by lightning is 1 in 500,000 of getting a blood clot on birth control pills, 1 in 1,000. So to put it in perspective, but it is important, it's essential. We have to review the data. There are some things healthcare providers need to know about these particular clots. So very key that we do this. And importantly, this is our system working. I want people to hear that. The monitoring systems are in place for Johnson & Johnson, for Moderna, for Pfizer, for all of them. So even as we have our conversation tonight, from the top, a takeaway is that vaccination saves lives, absolutely. And we still encourage everyone to get vaccinated as soon